Hi, my name is Dr. Bunkis of Orange County Plastic Surgery in Newport Beach, California, and Salisbury Plastic Surgery in Worcester, Massachusetts. Today we're going to be inserting some hormone pellets into a patient. We'll talk a little bit about why we do this. As we age, our normal hormone levels start to decrease, and once you get over 40, 50, 60, levels keep going down and down. And if you ask a laboratory if your levels are normal, they'll tell you they are for your age. But as we age, many of us want to feel like we did when we were younger, and we can accomplish that by putting customized pellets into our bodies, which slowly release hormones over 3 to 6 months. And today we'll see how that is done in the procedure room. Okay, we're in the room now, and the first thing we're going to do is mark where we're going to put the pellets, and we draw a little mark where the incision is going to be. And I always mark where I'm going to put them, so when I put the local in, there's no question about where I can put the trocar with the pellets. This is our insertion kit. As you can see, we've got the little pellets inside the container, and the trocar itself is a round tube that has a lumen in it, and we put in the solid part so that it slips into the tissues easier. Once it's in, we take the central part out and we put the pellets in here, and you'll see how that works in a second. It's a tiny stab wound where we want the pellet to go in. Pellet is testosterone, the smaller one is estrogen. You can see I keep this little cup here, so if I drop a pellet, it goes into the sterile cup instead of where I don't want it to go. Then we take the central little trocar and we push the pellet in. I turn it 90 degrees, give it a push, pull it out, and the pellet's in.